How do you measure the progress of your work? In the nonprofit arena, there are many approaches to measuring progress. Results-based accountability is an approach that attempts to simplify the whole process of measuring progress. And so, one of the concepts that's important to be familiar with as you're trying to understand results-based accountability is collective impact. This is the idea that if you're looking at really large, complex social problems, it takes multiple organizations working together on different parts of the problem to really be able to shift and make change and have an impact. And we know that the success of these joint efforts have some consistent characteristics. You need to have specific things in place for those joint efforts to be successful. They're represented by these 5 blocks. So can keep that in mind as we move forward. Results-based accountability graphically shows you how to think about how those individual efforts flow into a way to measure the impact on the direct clients all the organizations are serving. And when you measure the effectiveness of a program or an agency or even the service system like the healthcare system or the early childhood system in our case, results-based accountability calls the data that you use to track that performance measures. And the theory is that there's a ripple effect when you have an impact on your clients that will affect the entire population, even though you may not be directly serving the entire population. And the data that you use to track that impact on the population, results-based accountability calls population indicators. So of all the data that's available out there, how do you decide which ones really will work to track your progress? Results-based accountability says that good measures have 3 characteristics. They're easy to understand. They have high communication power. If you talk to your grandma, she knows what you're talking about. They have proxy power, and that means they say something important, but they also can stand in for a lot of other data. They bring a herd of data with them. For example, 3rd grade reading scores may tell you something about whether children were read to when they were little or their parents' education level. So you want to have a data element that brings the greatest herd with it possible. And of course, you have to be able to get the data, and it has to be recent enough to be meaningful. So hopefully your measures will rate high on all 3 of those. But occasionally, you may find a data element that you want to track, but you don't really have the data right now. But you can think of a way that you can gather it. So those items go on your data development agenda. So when you're looking at performance measures, one of the things that's really critical is that the data that you choose answer these 3 questions. How much did we do? How well did we do it? And who's better off? If it doesn't answer those 3 questions, it's probably not a measure you want to use. The way that results-based accountability tells you you know when you have success is if you track your data elements over time and you forecast what's going to happen. You know you've been successful when you start to change that path, and that's called turning the curve. So results-based accountability provides us not only a way to measure the work of our individual agency, but a way to track the success and the impact we're having when we all work together. So now I'm going to move into my part of the presentation and talk about the journey of the Early Childhood Council of Larimer County as we begin to use results-based accountability. And sometimes we felt that trying to evaluate our work is crazy making. And results-based accountability gave us a way to put some structure around it and of course sort of organize that chaos of trying to figure out if we're really making a difference. Before we get too far into the discussion of results-based accountability, I thought it might help you to know what we're trying to accomplish, what our mission is. And the mission of the Early Childhood Council is to bring the community together, to share knowledge and resources, to build expertise, and to work collaboratively to ensure that all young children in Larimer County have the care, support, and opportunities they need to grow and learn and succeed. And like a lot of organizations, we needed to find a way to know if we were fulfilling that mission or whether we were just howling at the moon. So when we started looking at collective impact, we realized that we were doing pretty well in 4 of those components, but we didn't have shared measurements. So we thought, we know all of our partners are doing evaluation. They're collecting data to measure their work. We can just get everybody together, figure out what they're collecting, and then we can determine which ones are shared measurements that we can use to measure the effect of our collective efforts. So we brought everybody together at one of our monthly advisory council meetings, broke up into small groups, and asked them these questions and recorded the results. And this is just a fraction of what we got. We had pages and pages and pages of data. And we were kind of lost. We started feeling like this poor little donkey. But fortunately, about this time, our executive director went to a presentation on results-based accountability, and she came back really excited about the possibility that results-based accountability offered to organizing our thinking and to get some clarity around how we're going to measure our results. So the first thing we did was we took those pages of data, and anything that didn't answer one of these questions we threw out. And then we organized all that data around our strategic goals, and this is what we came up with. Now, I know you can't read this, but I wanted to just show you a visual of where RBA had led us. And we were really excited about this chart. We thought it was terrific. We finally had concrete measures under each of our goals, a finite number that we could begin to track over time. And we stayed excited until we started thinking of the systems that we need to have in place to actually track this data over time. And then we started feeling a little bit overwhelmed again. So fortunately, about this same time, the Colorado Trust decided they're going to use results-based accountability to evaluate the 5-year grants they awarded to early childhood councils, including Larimer County. And as part of that effort, they contracted with a woman named Deidre Epps with the Result Leaders Group to provide technical assistance to councils as they started to understand and learn how to use results-based accountability. And that was really critical for us because we would get stuck and we would get our thinking all tangled, and Deidre helped us untangle so we could move forward. So the first thing she did was she helped us recognize that in those lists on the bottom half of that chart, we still had mixed in a lot of population level indicators. So we pulled those out and we ran them through the test of what makes a good measure: communication, proxy, and data power. And then we moved on. Well, these are some of the indicators we came up with: 3rd grade reading, immunization rates, and child abuse and neglect rates as our high-level population indicators. When we moved to performance measures, we realized we had a really big problem, because we had organized all of those data points by our strategic goals. And we were coming to the end of our 3-year strategic plan, and we're going to be creating new goals. And we knew we were going to have a hard time tracking those data points over time if they were organized around our goals, which were going to change. So we needed a new way to organize our goals. So another epiphany came when we went to a Colorado Trust Technical Assistance meeting, and they challenged us to think about who are our customers. And we thought, wow, we can just organize our data around our customers because our specific goals might change depending on our community needs assessment, but our customers are not going to change. But the other thing we realized is we talk about the impact we're having on children, but our agency provides no services directly to children. So children really aren't our customer. So we had to distinguish between our customers, the customers of our agency, and our service systems customers, and organize our data at two levels. So we once again took all the performance measures through the communication, proxy, and data power assessment, looked back at that chart and pulled those out, and this is what we came up with. The items with the red background are our population level indicators that we're going to track over time. The items in the blue background are our service system indicators, and the red text is our data development agenda. We also realized that we have another customer that we hadn't thought about, and that's our partners. We provide a lot of support to our partners. We bring in, last year we distributed $80,000 to child care programs to help them implement higher quality services. We distributed over $60,000 in college scholarships to people who work in child care so that they can up their skills and do a better job. So we need to be tracking how we support our partners. So now we have some measures that we can use, a much smaller number of measures that we can use to track whether we're really making a difference. The point we're at now is we're beginning to track some of that data over time to see if we can start to turn the curve. We don't have historical data for a lot of our points, but we do have historical data for the number of child care programs that enroll children or willing to enroll children who are getting child care assistance. This is a program to help support low-income working families so that they can have child care and go to work. And you can see that the number of programs has gone down over time. But we need to really start thinking about what is the story behind that data? Why is that decline occurring? So that we can develop strategies to actually turn the curve and make a difference, change the path of that trajectory. So result-based accountability has given us not only a way to measure our individual work, but to have some ways to measure the impact of the work we're doing together. But what is really helpful is that we also now know that we don't have to be responsible for the entire effort, that each individual organization is only responsible for their part of the work. So if you are interested in more information, I'd recommend picking up the book Trying Hard is Not Good Enough. It's basically the RBA Bible, and you can use it as a reference to go back to time and time again when you get stuck. Mr. Joseph.
Thank you, Linda. Have a seat.